You wake up exhausted even after 8 hours of sleep. You can't focus. Your brain feels like it's wrapped in a thick fog. You walk into a room and forget why you're there. Your joints ache for no reason. Your skin breaks out in random rashes. You have static shocks, metallic tastes in your mouth, and your doctor, they run standard blood labs, a CBC, a metabolic panel, and they look you in the eye and tell you everything is normal. But here's what they're not telling you. There's a silent invader in your home, in your workplace, maybe even circulating in your blood. Right now, that's sabotaging every system you have. It's called mold. But it is not just an allergy. It's quietly dismantling your immune system, your brain, your hormones, everything. I'm Dr. John Kim, and today we're going to talk about the epidemic that most doctors completely ignore, the toxic relationship between mold exposure and chronic complex illness. And you need to watch this full video because the solution isn't another prescription, and it's not just cleaning your house. It's a medical protocol that addresses the root cause of why your body can't heal and why conventional medicine keeps missing it. Let's start with the hard truth. Mold isn't just that black stuff you see in the grout of your shower. It's a living colony, a fungus that releases microscopic spores into the air you breathe. But here is the scientific distinction that changes everything, and this is where people get confused. The spore is the reproductive part of the mold. It's big enough that a mask might catch it. But the real danger, it's the poisons they produce. These are called mycotoxins. Mycotoxins are secondary metabolites. They are chemical gases. They are nanoparticles, zero point 0.1 microns in size. That means they are small enough to pass right through most standard filters, right through your lungs and directly into your bloodstream. We're talking about chemicals like ochratoxin, aflatoxin, gliotoxin, trichothecins. These aren't allergens. These are biowarfare agents. In fact, T2 mycotoxins have been studied for biological warfare. That is how potent they are. They are neurotoxic, meaning they poison your nerves. They are immunosuppressive, meaning they shut down your defenses. And they are carcinogenic, meaning they can drive cancer processes. And when you inhale them, because they are fat soluble or lipophilic, they don't just stay in your lungs. They cross your blood-brain barrier and they dissolve into the fattiest parts of your body, which includes your brain, your myelin sheaths, and your hormones. This is not a stuffy nose issue. This is systemic poisoning. And the worst part, most doctors are never trained to look for it. They see your symptoms: chronic fatigue, brain fog, joint pain, gut issues, anxiety, insomnia, light sensitivity, and they play a matching game. They label it as fibromyalgia or chronic fatigue syndrome or IBS, or they tell you it's just depression. They give you an antidepressant or a pain medication like Lyrica or gabapentin and send you on your way. But they never ask the one question that could change your life. When did you last live or work in a water-damaged building? Let me tell you exactly what is happening inside your biology when you're exposed to these toxins. First, your immune system enters a state called the cell danger response. Your body recognizes these toxins as foreign invaders, so it activates your innate immune system, releasing a storm of cytokines like IL-6, IL-8, and TNF-alpha, and creates a massive spike in oxidative stress. Now, inflammation is supposed to be short-term. It's a fire that burns the enemy and then goes out. But because you are breathing these toxins in every day, the fire never goes out. It becomes systemic inflammation. This leads to something called CIRS, chronic inflammatory response syndrome. It's like having the flu every single day without a fever. Second, mycotoxins assault your mitochondria. Your mitochondria are the engines inside your cells. They take the food you eat and the oxygen you breathe and turn it into ATP, energy. But mycotoxins act as metabolic poisons. They damage the inner membrane of your mitochondria. They disrupt the electron transport chain, and your ATP production collapses. This is why you have post-exertional malaise. You try to exercise and you crash for 3 days. It's not because you're out of shape. It's because your cells literally cannot generate the fuel to recover. Third, and this is crucial, mold toxins create a vicious cycle in the gut. We know that 70% of your immune system is in your gut, but mycotoxins are antimicrobial. They kill off your beneficial bacteria, the diversity you need for health. This creates a vacuum for opportunistic pathogens like Candida or Clostridia to overgrow. This damage creates leaky gut or intestinal permeability. The tight junctions of your gut lining break open, allowing undigested food and toxins to leak into your bloodstream. Your immune system attacks these particles, and in the process, due to something called molecular mimicry, it starts attacking your own tissues. This is often the trigger for Hashimoto's rheumatoid arthritis and lupus. And fourth, the neuropsychiatric effect. Because these toxins settle in the brain, they cause neuroinflammation. They inflame the hypothalamus, the control center of your brain. This disrupts your sleep hormones, your stress hormones, and your mood regulation. This is why you have anxiety that feels physical. This is why you have word-finding difficulties. You know what you want to say, but you can't get it out. It's not a mental health issue, it's a brain toxicity issue. Now here is why you might be sick, but your husband or wife is totally fine, even though you live in the same house. This is the piece Western medicine misses. It comes down to genetics, specifically the HLA-DR gene. About 24 to 25% of the population has a genetic variation that makes their immune system blind to mold toxins. In a normal person, if they breathe in mold, their immune system tags the toxin, creates an antibody, and detoxifies it naturally. They might get a headache, but they get over it. But if you have this dreaded gene, your body cannot tag the toxin. It doesn't present the antigen. So you breathe it in and your body doesn't know how to get rid of it. It creates inflammation, but it never eliminates the poison. The toxins recirculate. They get stored in your fat. They build up year after year. If you have this gene and you're exposed to a water-damaged building, you're filling a bucket that has no hole in the bottom. Eventually, it overflows. So how do we fix this? Because you can fix this. Western doctors will run an IgE allergy test. It will come back negative. They will tell you you're fine. IgE is for allergies, sneezing, and itching. We are looking for toxicity. You need to run a mycotoxin urine screen to see what is coming out of your body. You need to run a visual contrast sensitivity test, a VCS test, which checks for neurotoxicity. And you need to look for inflammation markers like C4a, MMP9, and TGF-beta1. If those are high, you are dealing with mold illness. Here's the protocol, and this needs to be done in order. Step 1 is the hardest: avoidance. You cannot heal in the same environment that made you sick. It is biologically impossible. You need to test your home. Do not rely on those cheap Petri dishes from the hardware store. They are useless. You need an ERMI test, that's ERMI, or a HERTSMI2 test. These use DNA analysis to identify the specific molds in your dust. And if you find mold, you need professional remediation. And listen to me closely, do not use bleach. If you have mold on a porous surface like drywall or wood, bleach only kills the surface color, but the water in the bleach actually feeds the roots of the mold deep inside the material. You bleach it, and 2 weeks later it comes back stronger. You need physical removal of the materials, and you need to fog the home to kill the spores in the air. Step 2, open detox pathways. Before we pull toxins out, we have to make sure you can poop, sweat, and pee them out. If you are constipated, you are just reabsorbing toxins. We need to support your liver and your bile flow first. Step 3, binders. This is the game changer. Your body excretes mycotoxins through bile. The bile goes into your intestines. But here is the problem. Your body is designed to be efficient. It recycles 95% of your bile. This is called enterohepatic circulation. So your liver dumps the toxin and your gut reabsorbs it. You are auto-intoxicating. We use binders, substances like activated charcoal, bentonite clay, zeolite, and prescription cholestyramine. These binders act like a magnet in your gut. They grab the toxin-filled bile, trap it, and ensure you poop it out of your body. But you have to take them on an empty stomach, at least 30 minutes before food or 2 hours after. Otherwise, they just bind your lunch. Step 4 is antifungals. Once the load is down, we have to treat the colonization in your sinus and your gut. We use nasal sprays and herbal antifungals to clear the reservoir living inside you. Step 5, mitochondrial resuscitation. We need to turn the lights back on. We use high-dose CoQ10, PQQ, L-carnitine, and phospholipids to repair that cell membrane damage we talked about earlier. This is where you get your brain back. This is where the fatigue lifts. Let me be clear with you. Western medicine is brilliant at acute care. If you have a heart attack, go to the ER. They are heroes. But for chronic invisible illness, they are operating on an outdated map. They treat symptoms, not systems. They give you a pill to lower inflammation, but they never look for what is causing the fire. Functional medicine looks upstream. We don't just want to know what you have, we want to know why you have it. So if you have been struggling, if you feel like a shell of your former self and no one has been able to help you, I want you to ask yourself, could it be the air I'm breathing? Could mold be the anchor holding my health down? Because here is the truth. Your body wants to heal. It is designed to regenerate. But it cannot do that if it is carrying a toxic load it wasn't built to handle. If this resonates with you, stop guessing. Click the link below to book a discovery call with my team. We specialize in biotoxin illness. We will help you run the right tests, investigate your environment, and build a protocol to get these poisons out of your body safely. Or if you want to understand more about how toxins destroy your gut health, watch this video next. You are not crazy. Your symptoms are real, and there is a way out. I'm Dr. John Kim, and I'll see you in the next one.